Good morning, everyone. And what a lovely vista we have ahead of us. Thank you all for joining us on this very special occasion, the launch of the Future Health Research and Innovation Fund Strategy 2025 to 2030. We begin with welcoming Mr. Rohan Collard, Principal Research Fellow at Murdoch University, Nankura Institute for Change. Rohan is also part of Yorga Maman and Kulanga Research Centre, who will welcome us to country. Rohan is a Noongar man with connections to Whadjuk Balladong regions. He has extensive experience in social services, strategic planning, case management, field work, and is currently the manager for community engagement and funding at Wunjinning Aboriginal Corporation. The Nankura Institute works closely with the WA Government to contribute high-level expertise to projects and initiatives that seek to ensure Aboriginal women have access to culturally safe maternity care. The Yorga Maman and Kulanga Research Centre supports multidisciplinary cross-institutional collaborations between researchers, clinicians, community members, elders, policymakers and health services to support translational research that benefits Aboriginal women, men and families. Would you please put your hands together for Rohan?
Thank you. Yes, firstly, I'd just like to acknowledge that we are meeting today on Whadjuk Budja, and my name is Rohan Collard, the Principal Research Fellow at Nankura. I guess as I stand here today on Whadjuk Budja, I just want to pay my respects to my elders past and present, and also the Noongar people and Aboriginal people in the room. The work we do at Nankura, we believe is central to our healing, specifically my role where I am leading the research into Aboriginal men's social, emotional and wellbeing. We're researching, I guess, that field because it has been a field that has been left away from the table for such a long time. Throughout my extensive history in community services, we haven't had men at the table as part of decision making for a long time. A lot of the work we do is about embedding Aboriginal definitions of health, so a holistic well-being, physical, emotional and spiritual understanding of that, which is held together by our land, our connection and our law. I guess for me, healing journeys are guided by yarning and on-country experiences, but also, I guess, remembering what our people have been through, but remembering also that our people are very resilient and we are still here today, sharing our language and our culture that's the oldest in the world. I guess through the programs, we've seen the success of young Māman become leaders, but also, I guess, identify where they felt they needed to address some of the change to be solid men in our community. And I think for us, that work, it doesn't just inform programs, it shapes policy, it shapes where the funding can go, which I guess for me, the alignment with why we're all here today is very important, with embedding that cultural healing into some of those programs, but also that research and the policies that we create. So kaya wanju, nyan nicha Whadjuk Budja, nyan kwel Rohan Collard, nyan Noongar Māman, nyan Noongar Budja Kura Yeyi, nyan Noongar Wankaning, nyan Noongar Baraning, nyan Noongar Garaning. So wanju, welcome again to Noongar Budja, and I hope your day is a wonderful day. Thank you very much.
Thank you, Rohan, for that welcome. We're very privileged to be standing here on the land of the Whadjuk Noongar people in the Rosemary van der Berg room at Murdoch University. Rosemary van der Berg was an esteemed Noongar elder, writer, historian, wife, mother, grandmother, great-grandmother and great-great-grandmother, as well as the first Aboriginal person in Western Australia to be awarded a PhD. It's fitting that we would hold the launch of a new strategy that seeks to build excellence in health and medical research and innovation in a room named after a woman who was so passionate about seeking knowledge. I'd also like to acknowledge some of our special guests, Minister for Medical Research, the Honourable Stephen Dawson, Director General of the Department of Health, Dr. Shirley Bowen, Vice Chancellor of Murdoch University, Professor Andrew Deeks, Professor Peter Eastwood, Deputy Vice Chancellor of Research and Innovation at Murdoch, FHRI Fund Advisory Council Chair, Rebecca Tomkinson, AC members Kane Blackman and Jennifer Lawrence, and invited guests, welcome. My name is Paula Voce and I'm with WA Health. Before we begin, the nearest toilets are out the door, and if you turn right and right again, it's in the first alcove. Emergency exits are via the doors at the front and back of the room, on the side, not at the back of the room. And then the muster point will be on level 1, right in front of the large MU sign. This strategy is the culmination of months of work and the expertise and effort of more than 300 stakeholders, the FHRI Fund Advisory Council, Office of Medical Research and Innovation staff, and consultancy firm SIA Partners. The strategy sets out the strategic direction of how the FHRI Fund will support health and medical research and innovation for the next 5 years and beyond. To officially launch the Future Health Research and Innovation Fund strategy, I'd like to welcome the Minister for Medical Research, Honourable Stephen Dawson. Please make him welcome.
Thank you, Paula, and good morning, everybody. Kaya, Nalakadich, Wajok, Nyunga Murt, Kaya, and Kadak Nijibuja. Can I too acknowledge that we're in the land of the Wajok people of the Noongar Nation today and pay my respects to elders past, present, and emerging. Can I acknowledge all First Nations people in the room, and thank you, Rohan, for your welcome today too. Everybody, of course, in this room is very important. I could name you all, but can I particularly acknowledge the Vice-Chancellor of Murdoch University, Andrew Deeks, and the Deputy Vice-Chancellor, Peter Eastwood, and thank them for having us here this morning. Not too many UWA people in the room. I've obviously had, not done well getting down the freeway and finding parking, but I'm very glad that everybody else has made it this morning down to Murdoch. Can I also acknowledge you all, because of course this new strategy would not be here without many people in this room, including the team at OMRI, the Office of Medical Research and Innovation, but the FHRI Fund Advisory Council Board, led by Rebecca Tomkinson, the chair, and of course we're joined by Kane Blackman and Jennifer Lawrence today too. I do also want to acknowledge Rebecca, having just been announced as the new Agent General in London, and she will leave the role of chair in the next couple of months and go to be our representative, Western Australia's representative in London. So congratulations, Rebecca. It's been great to have you as the chair for the last few years. Thank you. So big shoes to fill. I'm looking for a new chair. I'll just put that out there. Spread the word. So it is a great privilege to be here today to help launch the Future Health Research Innovation Fund Strategy 2025 to 2030, a bold and indeed forward-looking vision for Western Australia's next chapter in health and medical research. This new strategy marks a bold shift in our mission to lead the way in understanding disease, preventing illness, and reducing disability. It is the result of a united but also a collaborative approach across our health and research sectors. And again, thanks to all of those who've been involved for their work. This strategy does stand as both an ambitious blueprint and a reflection of Western Australia's unique capabilities. Now, since the FHRI Fund's inception in 2020, more than $260 million has been invested into hundreds of initiatives. And this establishes a solid foundation for sustained progress and innovation in our state. This new strategy builds on this success with a decisive shift from broad capacity building to targeted, transformative, and tangible impact. But we aren't simply just continuing this work, we're taking a strategic leap forward. The FHRI Fund now enters a new era of clarity and purpose, firing up life-changing health breakthroughs and accelerating their translation into patient care and meaningful outcomes. Our vision is clear. We will enhance WA's health system, making it more responsive, more innovative, and more inclusive. Our new strategy clearly defines 3 strategic themes. They are connect and collaborate, which is about connecting the health, research, and innovation community to drive significant impact, to accelerate and translate, which is about empowering innovation and commercialisation in WA, And finally, foundational confidence. And this means we will continue to deliver essential support that strengthens the foundations needed to build a competitive, resilient and world-class health sector. We're committed to cultivating a thriving research and innovation ecosystem, but also driving economic growth in Western Australia. And we're committed to improving health outcomes for all Western Australians by embracing cutting-edge clinical trials, empowering community-led research, and encouraging the potential of emerging technologies. We're on a path to position WA as a global leader in health and medical research and innovation, driven by a bold ambition to rank among the world's top 10 in health, making WA renowned for its pioneering breakthroughs and excellence in the field. Through strategic collaboration, driven by excellence and united by purpose, we will ensure that our state is recognised nationally and internationally as a place where world-class research delivers real-world impact. The 2025 to 2030 strategy sets a bold vision for our state to lead in areas where our capabilities are strongest: Aboriginal health, rural and remote innovation, precision medicine, and digital health. At its core, it's about turning research excellence into tangible outcomes that improve lives, but also strengthen our health system and grow our state's economy. As the Minister for Medical Research, amongst other things, I'm very proud to champion this strategy and the future that it represents: a healthier, a more prosperous, and a more connected Western Australia. The FHRI Fund Advisory Council, supported by expert committees, will continue to guide funding decisions with rigour and integrity, providing targeted investment to enhance WA's strengths. With powerful priorities and disciplined management, WA is poised to lead in global health innovation. Now, transparency and accountability are central to this strategy. And so the Advisory Council, supported by the Department of Health, has defined a framework that will measure and monitor progress of the vision, but also the strategic goals, the themes, and the priorities on a regular basis. And in line with our commitment to transparency, an annual report will be published online, showing the progress against each component. To accompany the strategy, an investment plan will also be published annually, which matches the available forecast investment income generated by the Sovereign Wealth Fund. And the robust measurements and monitoring plan and its annual investment plan will ensure that the FHRI Fund achieves its purpose to fire up life-changing health breakthroughs for Western Australia. Ongoing collaboration with stakeholders and the community will ensure that the strategy continues to reflect the needs, but also the aspirations of our sector. At its heart, this strategy is about securing long-term value for Western Australians by building a sustainable sector that is future-focused, that is globally connected, and proudly driven by Western Australian expertise. These investments are designed to build capacity, capability, and to forge pathways for future generations, enabling them to drive transformative health and economic benefits through a stronger but also a more connected sector. Together, we're shaping a future where WA is at the forefront of health and medical research and innovation. And I certainly look forward to continuing the important work with all of you, whether you're a researcher, a clinician, an innovator, and a partner, as we bring this strategy to life. Thanks very much. Thank you for being here.
Thank you very much, Minister Dawson. Our next speaker is FHRI Fund Advisory Council Chair, Rebecca Tomkinson. Ms Tomkinson is the Chief Executive Officer of the Chamber of Minerals and Energy of WA and joined the FHRI Fund Advisory Council in April 2024. Rebecca brings a wealth of knowledge and experience from the private and non-for-profit sectors and is deeply committed to the development of regional WA and actively involved in community and business capability. Please welcome our Chair, Rebecca Tomkinson.
Thanks very much, Paula. And can I too just say what an incredible room it is and just acknowledge all of our special guests with us today, but most importantly, all of you. I also want to acknowledge Professor Fiona Wood, who is on our advisory board as well, a great West Australian and a really significant contributor in all things in WA, but particularly for us here on the Advisory Council. It's also quite special for me. This is my alma mater. So to stand here on the grounds today at Murdoch University, Professor Deeks, thank you for your warm congratulations on the new role that I have, but also in supporting medical research here. To Rohan, the engagement, I've had the privilege of spending a little bit of time at the health centre, and it really is very special. So I was saying to Minister Dawson, the connections, the energy, the community that we're building, even just where we're launching the strategy today is quite special. And I know all of you will continue to see just what is possible here in WA. As we've spoken to, I get to tell you a little bit about the detail. I am pretty excited that we are committed to fueling. You've got to help me with some of the analogies. You can see that, right? We're a fiery fund. We're fueling, we're firing up, we're getting in behind it. The sector's ambition to anchor research and innovation firmly here in Western Australia. The new strategy concentrates on areas where WA can offer something truly valuable, both to its own community, but really importantly to the whole world. We are privileged to have the Health Research and Innovation Fund, a sustainable funding base, ongoing government support to, as I say, we're going to fuel the sector. It's not going to get old. We're going to keep that up all the way through. It's also important to acknowledge that we are stewards of a long promise to the West Australian community, and that as part of that, we have a commitment to build that intergenerational opportunity that the fund promises. In the past 4 years, as Minister Dawson said, we've done more than $260 million into research fellowships and innovation programs. It has been a success, and it is great, but the true rewards are really still to come. Pieces that most of us in the room will probably never have the opportunity to see, but know that we were a part of building. I'm confident that our new look strategy will absolutely catapult Western Australia to new heights in health research and innovation. I would like to thank Minister for the incredible opportunity to lead this amazing advisory council and to be part of building this very unique strategy, for his courage. We have been a little bit bold, and I'm sure that there will be a tiny bit of feedback about some of the intent and the direction behind that document, and he has stood with us the whole way, and I know that that is going to really set the fund up for much success, and I look forward to being able to watch that success grow and also to promoting that, indeed now globally, in a new capacity. The purpose in firing up, I'm going to get the whole room every time, the life-changing breakthroughs in WA, and to accelerate and translate those discoveries and solutions to patients' care. Our vision is by 2035 to triple the impact of health research and innovation with a uniquely West Australian focus. Our strategic themes are connect with the health research innovation community to collaborate for impact, strengthen innovation and commercialisation through partnerships and inspiration, and to deliver underlying support to build a strong competitive sector. As we talked about, there are the key themes, the key strategic themes of connect and collaborate, which will bring the health research and innovation community together. There are 3 key areas in this spot: to empower pathways and collaboration, inspire impact and an aligned focus, and to be bold and predictable. Through this theme, we will set out to achieve shared solutions across disciplines, sectors and services through pathways and collaboration. We will fund initiatives that concentrate Team WA's effort on uniquely West Australian health challenges. We will also look each year to commit to one major West Australian issue and support that over 5 years with targeted funding. This will be our Spotlight program. It'll be the flagship innovation under the new strategy, and Dr. Shirley Bowen, Director General of Health, is going to come up and share a little bit about the Spotlight program with you in a moment. Our second piece is looking at accelerate and translate, and that's all about the three areas in priority of underwritten innovation to activate the innovation community and to build partnerships. Through this theme, we will build a thriving innovation pipeline, enabling high conviction investments, talent development, and a whole of sector uplift. We will support high potential, early stage innovations that carry commercial and translational promise. The funding will be structured, really importantly, to absorb the early risk and provide clear, staged, gated progression towards that commercialisation and translation, which can often be the most challenging in that early stage of an innovation project. We will build momentum, visibility, and a stronger innovation culture in WA by providing competitive programs that promote bold thinking, commercial risk management, and invest in both our people and our companies. We also have the foundational confidence as our strategic theme. We will continue to deliver the underlying support that we have shown through a strong competitive sector through this strategic theme. It will retain early to mid-career researchers. It will attract and retain world-class talent, and we will make WA competitive on the global stage. We will support the workforce systems and infrastructure that underpin WA's health and medical research innovation sector, ensuring it can attract top talent, be competitive for national grants, and deliver sustainable growth. And we will focus on retaining early to mid-career researchers. We've been paying attention, Fiona. We know how important that ecosystem is, and attracting and retaining world-class talent to make WA very competitive. As the Minister talked to, there's a number of next steps. Our direction is very clear, but there is a lot of work ahead of us to ensure that we really bring this strategy to life. And when I say us, I mean this entire room, everyone together. The core foundation of our strategy is that focus on collaboration together and building that community. The investment plan will accompany the new strategy, and the plan will set out the available forecast investment and programs aligned on a yearly basis. We are expecting around $277 million over the next 4 years. And I know how important that is to the innovation and research community in understanding what those financial horizons will look like. Also, really importantly, there will be a framework of outcomes and ongoing reporting. To that very transparent aspect, the outcomes framework will follow. It will link the activities of the fund to those 4 key strategic themes that I've just outlined. The Advisory Council, supported by the Department of Health, will develop the framework to measure and monitor the vision, the strategic goals, the themes and the priorities on a regular basis, and through that annual report, be able to hold the accountability to not just intergenerational West Australians, but really importantly, all of you on an ongoing basis. The third part of that will be that the fund will also have a program and initiative catalogue to develop new programs that align through those key themes that we've discussed. I'm very excited, and I know all of you are in the room really to hear this statement that we are going to open funding again this year, aligns after this launch with the new strategy and with the programs that are already in place. It is very exciting to have the opportunity to get that funding out the door. It's very significant for everyone in the room. We had wanted, and we appreciate your graciousness and patience as we built this, to really align that to the strategic direction. Now we can share that with you. We can show you what those programs will be as quickly as possible. In closing, I just wanted to highlight how engaged we are, how very committed to ensuring the long-term sustainability of this fund and the long-term impact for West Australians. This new strategy introduces a more structured, focused and reliable approach to funding with regular grant cycles and clear expectations. Hopefully in those words, you will see that your feedback, your engagement with us, the work that you have done, we have heard. We know how important the regularity of that is. We know how important it is for you to be able to see the results of what we're all doing together. As I mentioned, collaboration is absolutely the bedrock of this strategy, and we are committed to working together with everybody to ensure that we are able to deliver together, tripling the impact of this fund in the programs that we have outlined. I'd also just like to say a very personal thank you to the Advisory Council. It has been a privilege to be able to lead an incredibly talented group of people. When Minister Dawson first asked me to do that, I was just in awe of who was around the table and the chance to not only get to work with them professionally, but also to represent those views of everybody here in the sector. I'd also like to acknowledge the Office of Medical Research for the work that they have put into being able to bring this strategy to life. Also, very importantly, I just want to say a big thank you to everyone involved in the last few years. It is, again, you get the moment to share a strategy, but there's only a strategy because a whole lot of really talented people did an incredible amount of work over an extended period of time. And we now have this chance to refine that and to continue to build it. I'd also like to acknowledge SEA Partners. They did an exceptional job and I know that because you have all shared that with me, and I know how you would share that otherwise if that wasn't the circumstance. So we appreciate your candour and your feedback and your engagement with that process. Mostly today, I am ridiculously proud to be able to be a part of the opportunity to bring this strategy to you and to thank Minister Dawson for his ongoing commitment to this sector. Thank you very much.
Thank you very much, Rebecca. It's my pleasure to introduce Dr. Shirley Bowen, Director General of the Department of Health. Dr. Bowen holds dual fellowships in infectious diseases and sexual health medicine and was extensive clinical experience as a respected and dedicated healthcare leader. Her previous roles include Chief Executive of the North Metropolitan Health Service, CEO of St John of God Hospital, Subiaco, Chief Medical Officer of the Australian Capital Territory, Executive Director of Fremantle Hospital and Dean of the School of Medicine at the University of Notre Dame, Australia. Dr. Bowen has a deep knowledge across the health sector with executive experience leading public and private hospitals, research, education and community services, and holds a position of a non-voting member of the FHRI Fund Advisory Council. Would you please put your hands together and welcome Director General Dr. Shirley Bowen.
Well, good morning. Thank you so much, Paula. Can I start by also acknowledging Rohan Budjar and thank Murdoch University and Rohan for that welcome to us. I'd also just say thank you to Murdoch Uni, to Professor Andrew Deeks and Peter Eastwood for hosting us today, and then acknowledge our Minister for Medical Research. And I say that because he's ours. He's got lots of things to do, but Minister Dawson always makes time to be with us for events, to contribute to strategy and to move the sector along, and we sincerely do appreciate it. I also acknowledge Rebecca Tomkinson, our chair, and thank Rebecca for her leadership with the strategy. It's been fantastic. And thank you to our Advisory Council members who are here, particularly Fiona Woods, Professor Fiona Woods, as you know, Jennifer Lawrence and Kane Blackman for being with us. And they're with us all along the journey here, as all of you are as well. So over to me to talk about the spotlight today. And I'm really excited to do that because it's a bit of a pet project, actually, this part of it. You heard all that stuff I've done before. The important part there is that I'm an infectious diseases physician, so I apologise, but I'm always gravitating to a bacteria. So just going to say that. Can't help it. So thank you for being here with us today to launch this milestone new strategy for the FHRI Fund. It does put patients and outcomes first. It matures our vision because it aligns research excellence with real-world needs for our health system. The strategy's Connect and Collaborate theme brings WA Health's medical and research ecosystem together with precision, focus and ambition. It also underpins our flagship initiative, which is the Spotlight program. The Spotlight program is a bold new approach to tackling WA's most pressing health challenges. Each year, the FHRI Fund will commit to one major, uniquely Western Australian challenging problem, supporting it over 5 years, not just one, with targeted funding and support. So we have a 5-year program. Our ambition is to build lasting capability, spark powerful cross-sectoral collaboration, and most importantly, deliver tangible, measurable improvements in the health and well-being of the people of Western Australia. By focusing on translation, the initiative will ensure the discoveries don't just sit on shelves, they are implemented and, where possible, commercialised and made here in WA. Each Spotlight program is a catalyst for change. The 5-year targeted funding will aim to reduce the burden of the chosen disease through bold ideas in prevention, diagnosis, treatment, and, where possible, even cure. Some spotlights will focus on discovery. Others, like our first, will focus on translation and, in particular, translating what we already know into practice to make an immediate difference. We've already received strong interest from the sector and with lots of suggestions on spotlights for the future. So we have a bank of them and we're thinking and working on them as a council over the next few months. They include various chronic diseases, some areas of research in mental health, Aboriginal health equity and climate-related challenges. The Spotlight program also aims to attract co-funding and national attention, positioning WA as a leader in solving complex health problems through collaboration and innovation. It very much builds on the success of the Global Challenge program that we held over the last couple of years, and it is where the FHRI Fund was able to partner with BHP and Rio Tinto to address health service delivery in the Pilbara, and we hope to have those big collaborations again. And so I'm really delighted to announce that the first Spotlight will focus on rheumatic heart disease. Rheumatic heart disease remains a serious and preventable illness in Western Australia and the world, and it affects our Aboriginal communities far more than other communities. It mostly occurs, of course, in northern Western Australia, but there are people living in the metro with rheumatic heart disease today. It affects the Northern Territory, Queensland, and it is absolutely, though, a global disease. In particular, in Australia, Aboriginal people are affected 120 times more likely, more than non-Aboriginal Australians. And this is definitely contributing to our disparity with closing the gap. And this is one of the reasons that focusing on rheumatic heart disease gives us a great opportunity for our Aboriginal people, particularly here in WA. Despite this very significant burden of disease, we believe rheumatic heart disease is a problem with many solutions. They are all within our reach. They just need a bit more time, a bit more investment, and we can, through the Spotlight program, assist with action. We know that improvements in environmental conditions, skin programs that have been announced and fostered right here from WA, timely treatment of infection, early diagnosis, which can be done through remote technology and with digital assistance, can dramatically reduce the impact of rheumatic heart disease. Through the Spotlight program, with work already in progress, we will try and accelerate and expand trials, for example, with AI-powered diagnostic echoes, new formulations of penicillin, and also the work to bring a vaccine to the market. We have a bold vision to reduce the global burden of rheumatic heart disease. I would love to think that Group A strep, which causes rheumatic fever, rheumatic heart disease, and other similar consequences of Group A, became a rare disease. That would be really something that would be globally significant and really significant for WA and our people. We already have many WA researchers involved in the development of a vaccine to prevent Group A strep. The development of that vaccine is our ultimate goal, and WA can play a huge part in that research and innovation and bringing that vaccine closer to us. Investing in the prevention of rheumatic heart disease aligns with not only WA health priorities, but rheumatic heart disease prevention is a national strategy already. Rheumatic heart disease prevention will also support First Nations health advancement. And I've mentioned why, because of the burden of disease. But we also want to develop culturally appropriate models of care. And we really want this Spotlight to be really co-led by Aboriginal people. So by uniting our efforts, we can, I really believe it, eliminate rheumatic heart disease. The FHRI Fund has the funding, and now we look to make rheumatic heart disease a disease of the past. Rheumatic heart disease is our new spotlight, and now we're going to fire up, thank you Rebecca, the FHRI Fund for our new spotlight and move forward with you as we announce this, work on the funding and get it out to the sector very quickly. Thank you.
Thank you, Dr. Bowen. The Spotlight program certainly sounds like an exciting initiative and has the potential to make a positive difference. I'm looking forward to seeing how the Spotlight will evolve over coming months. I'd like to remind you, as VIPs of the sector, you have been given exclusive access to this new strategy, yet there is still a significant amount of work to be done before we can implement the changes. The team at the Office of Medical Research and Innovation is currently working on the framework, guidelines and structure we need to have in place to launch these exciting changes. So let's recap on the next steps. Investment plan, the FHRI Fund Strategy 2025 to 30 outlines a bold long-term commitment to strengthen WA's health and medical research and innovation ecosystem. To accompany this strategy, an investment plan will be published annually, which matches the available forecast investment income generated by the Sovereign Wealth Fund to planned programs and initiatives of the FHRI Fund. This annual investment plan will be published online to provide certainty and predictability to the health and medical research and innovation ecosystems, as well as encouraging co-investment with other partners. Our investment plan will be available in the coming months as we finalise the new FHRI Fund programs and initiatives. The Department of Health, alongside the Advisory Council, are now developing a measurement framework to measure and monitor the vision, strategic goals, themes and priorities of the new FHRI Fund strategy on a regular basis. This measurement framework will be published online and will be complemented by an annual report showing progress against all aspects of the strategy. Most importantly, the Advisory Council will now turn their attention to developing a new suite of programs and initiatives that bring the FHRI Fund strategy to life. These new programs and initiatives will include a mix of existing FHRI Fund programs that you, the sector, have told us you want to see continue, as well as new initiatives such as the Spotlight program that will be added to the FHRI Fund program suite. These new programs will be launched at our next FHRI Fund Open Day, which will be held later this year. And finally, we are working towards an activation plan for the FHRI Fund Advisory Council to bring them closer to you, our important stakeholders, to ensure the work of the FHRI Fund continues to deliver funding programs that will fire up life-changing health. So now that you've been introduced to the new strategy, we ask for your patience while we do this important work. And in the interim, we'd love to hear from you. Please take a moment to tell us more about the FHRI Fund programs you would like to see continue, as well as any funding programs or ideas you have to bring programs to life. The QR code shown on the screen behind me will take you to a simple form where you can tell us about the new FHRI Fund programs you'd love to see and what you'd like us to launch. A link to this form will be sent to all subscribers in the coming days, so we encourage you to share this among your networks. In the meantime, please ensure you are subscribed to the Omri newsletter, Inspire, and follow our new LinkedIn account, WA Medical Research and Innovation. On behalf of the team, I'd like to thank everyone who has contributed to the development of this strategy. It's an exciting time for the FHRI Fund, and a lot of hard work has been done to establish the fund over the past 4 years. Now it's time to transition to greater maturity. It's great to see everyone here today at the launch. If you have any queries about the strategy or the Spotlight program, you are so welcome to contact the Omri team, whose contact details are up on the screen. Please take a moment to follow the QR codes behind me to view the strategy, explore our priorities and subscribe for regular updates. Please stay and network, chat, and maybe even discuss the Spotlight Challenge while morning tea is served. We hope to see you again soon.